So diri nga video atin ipakita sa inyo kung ano bala ang anesthesia. Anesthesia or analgesia. Okay. May darawa kang pain occur kung paano occur ang anesthesia. Unang first stage is due to ischemia or uterine muscle caused by uterine constriction resulting obstruction of its own blood supply. This results in accumulation of pain metabolites. And second stage is stretching of perineal tissue by advancing presenting part of the fetus. Okay. Pain is caused by unpleasant feeling, maternal exhaustion, or maternal acidosis or fetal acidosis. Next is catecholamine released, maternal sympathetic, and this. Okay, next slide. Methods of pain relief. There are two kinds of methods, non-pharmacological and pharmacological. In pharmacological, opioids inhalation, epidural, and spinal. In non-pharmacological, first is educate on the process of labor and pain relief. Second is relaxation. Third is breathing exercise. And fourth is massaging. Okay, what is anesthesia? The word anesthesia is coined from two Greek words, an meaning without, and aesthesis meaning sensation. There are various types of anesthesia. Throughout their lives, most people will undergo anesthesia either during the birth of their baby or for surgical procedure, which could range from a relatively short, simple surgery on a day-to-day basis through to major surgery requiring complex rapid decision to keep them safe. Okay, classification anesthesia. There are two classification of anesthesia. The first is general anesthesia. Second is local and regional anesthesia. Okay, we to read the history. The first to use ether and chloroform for pain relief in labor in the United Kingdom was the eminent Scottish obstetrician Sir James Young Simpson, professor of midwifery at the University of Edinburgh. On January 1847, he administered ether to an obstetric patient and thus began a new era in the effective management of pain in childbirth. Okay, this is a Fanny Longfellow. This is beautiful. This is Emma Darwin and Queen Victoria. Okay, this is a picture. Okay, inhalational analgesia. N2O is the form of Anthrax, 50% of oxygen and 50% of nitrous oxide. Quick onset 1 to 2 minutes, short duration of effect 2 to 8 minutes. Start inhaling at the onset of the contraction. Not suitable for prolonged use of early labor because hyperventilation can cause hypocapnia, dizziness, and ultimately fetal hypoxia. Okay. In storage, Anthrax cylinder should be stored at about 10 degrees Celsius for at least 24 hours prior to use. The storage should be designed to prevent unauthorized entry to protect cylinders from the theft. Next is opioids. Petadine 75 mg, IM 4 to 6 hours or 1 mg per kg. With antiemetic or promethazine 25 mg or IM. S over E. Nausea, vomiting, delayed gastric emptying, respiratory distress reversed by naloxone, maternal drowsiness, and sedation. Morphine also can be used, but S over E, more respiratory distress. This is this picture. Next is opiates. Amphetamine, morphine, meperidine, butorphanol, and diamorphine. Okay. Optate administration. Optate tends to be given as intramuscular injection However, an alternative is a subcutaneous or intravenous infusion with a patient-controlled analgesic device. This allows the woman by pressing a dispenser bottle to determine the level of analgesia that she requires. If a very short-acting opiate is used, the opiate doses can be timed with the contraction. This method of pain relief is particularly popular among women who cannot have a epidural and find an pharmacological option inefficient. Okay, there have two kind of anesthesia. First is local anesthesia. Is a reversible loss of sensation is defined of area of the body and is achieved by the topical application or injection of agents that block degeneration and a journey of nerve impulses in tissue. Regional anesthesia is essentially local anesthesia but covering a larger area of subcutaneous tissue or larger peripheral nerves. Okay. Mechanism of action local anesthesia. They act from inside the nerve and inhibit new influx, membrane stabilization. Fibers can affect it in the sequence sensory, cold, touch, pressure, and lastly motor, or and unmyelinated before myelinated. Recovery occurs in a reverse direction. Okay, methods of administration. Surface anesthesia. By direct application through skin and mucous membrane. Infiltration anesthesia is by SC injection through its fine nerve branches and sensory nerve terminal. Nerve block anesthesia is by injection close to the appropriate nerve trunk, brachial plexus, to produce or loss of sensational peripheral. And the fourth is sympathetic block. It is injected around sympathetic ganglion. Fifth is paravertebral block. Second is epidural anesthesia and spinal. Okay. Classification of local anesthesia. I will tackle this in the part 2 of this video. I hope you like it, and if you're new here in my YouTube channel, please subscribe. Thank you.